Hello, my name's Stephen Lambert. I'm 58. I live in Weybridge in Surrey. I was first diagnosed with DLBCL in May 2019, and the symptoms of that, the thing that got me to go to the doctor was a breathlessness while walking upstairs. That was a symptom of the tumour I had in my chest, and that happened 2 weeks before my diagnosis. Longer term, looking back now, I realised I had a persistent cough and also a persistent feeling of having low-level flu that I think must have been symptoms of the disease, probably up to a year in advance of my diagnosis, actually. Oh, well, a massive shock, as you can imagine. The diagnosis itself takes a while. It's not a point in time. So for the cough and the breathlessness, I had an X-ray, and they saw the mass in my chest. So at that point, we knew something untoward was going on, but we didn't tell. We have 2 daughters, my wife Liz and I. We didn't tell them at that point. And then the final diagnosis took a series of biopsies and tests. So it was about 10 days, which is an awful time of worry, especially as you're keeping the secret to yourself in the household. So it felt worrying. And then when the final diagnosis came through, it was a shock, but oddly enough, it was a slight relief, because the consultant had said I might have had carcinoma, melanoma, or lymphoma, and he hoped I had the latter because it was the best one to get, and it turned out I did. So it was a strange sort of delayed shock combined with some relief, actually. So it was a family meeting where we practiced quite hard, actually. We said, look, it's going to be okay, but I have cancer. I have lymphoma. And then we explained what was going to happen and what that was all about. And we actually, straight the day after that, took them with us to see the consultant, because I knew they wouldn't believe us if we said things were going to be okay. So we went to see the consultant. He explained everything. And I think it wasn't better after that, but at least that helped them come to terms with it. Oddly enough, the first time was a horrible shock, because it was a different cancer that had come back, and being told it was very, very upsetting. The second time, because I recognised the symptoms, I knew what was coming, being told I had it wasn't a shock at all, because you get a bit expert at recognising the symptoms. So I wasn't shocked. We did have a rather disarming meeting with the consultant where she, with my wife, where she told us about my chances now, and they were quite largely decreased. So it took a deep breath. So that was tough. However, I was being treated at the Marsden by this point, and they really do know what they're talking about. And even though I'd had now a second relapse, the consultant was very, very good. Said she knew exactly what needed to happen. One thing, sometimes I know I spoke to Liz, my wife, about this, is the feeling of helplessness for your family. I was busy being ill. There were world-renowned doctors caring for me, which is fantastic. And then there's your family, and they want to help cure you and look after you. And of course they can look after you emotionally and help you in your recuperation, but they do feel a bit helpless. So I think being involved, they certainly found, and coming along to my treatments and things did help them. At the time, I know it sounds odd, but you're busy being ill. You have something to do, there are people looking after you, you spend a lot of time being treated or resting. So I'm not saying it's easy mentally, but you're busy. It's in times when you're feeling a bit better that you start to reflect, I found, on what's been taken from you and more on the people around you. Because when you're really deeply ill, you're quite self-obsessed and a little bit selfish, if I'm honest. So mentally after that, you start to think about your family and the life you might have had, and you get a bit resentful and angry. I was actually diagnosed after my second relapse with PTSD, or post-traumatic stress. My work were very good, and they kept my job open, and I stayed in touch. After my first relapse, I still stayed in touch. During my year-long remission, I started a gradual return to work, but then I relapsed again. And at that point, it was a mutual decision. We say I should call it a day and concentrate on getting better and concentrate on my family. So I actually retired 2.5 years ago. So I got psychiatric help that helped a bit. And I also had some talking therapy about coping mechanisms and learning not to be too angry and focus on the positive. So hard. I can talk about it now, but I'm 2.5 years out of treatment. But for a while, it was upsetting to talk about it. So it's still in there. It's an experience that has changed me and my family and will never go away. I think it's made me more grateful of health when you've got it. So it's changed my outlook on life. So there's some good things about it, actually. In terms of discussions with the healthcare professionals and any choices I was given, candidly, it wasn't like a multiple choice question. There was a recommended course of treatment, and what they thought was the best thing for us to do, we'd do. I mean, they know better than us, clearly. And in fact, I think I would have found the choice somewhat stressful. It was good to be told, this is what works, this is the best, here's what it means. I mean, they do make you sign about 5 pages of disclaimers that list the 400 things that could go wrong and be unpleasant about it. But you learn that that's legal small print. And if you ask them questions about what the more common side effects are, you can come to terms with that pretty quickly. So not choice, really. I would say I was given a clear path with risks and benefits, and then you sign on the line and get on with it, really. They do recommend, something at the Royal Mid Surrey and then at the Marsden, they do have charities on site and contacts of people you can talk to more broadly about your emotional needs. And I'll have someone come in and chat to you, or there are centres you can go to if you need to. I also had, as I said, some therapy alongside it. But I think they're there to cure the disease in my experience. The one thing I would say is that the nurses, both the Macmillan nurses and those up at the Marsden, they've seen people go through what you're going through a lot. And just having a chat with them, or even the patients in the chair next to you having the chemo, is quite useful sometimes, because there tends to be a sense of, oh, why me? And realising it's not only you is quite helpful sometimes, and comparing notes with them. So I found that emotionally quite useful. So in terms of how my it's the family's healthcare professionals talked about DLBCL, my treatment and my diagnosis, I would say overall it was good, as far as that sort of news can be good. It was fact-based. There was some empathy. It varied a bit. Some were more matter-of-fact, some less so. But probably one of the most difficult conversations I had with someone at the Marsden, and I mean, she was wonderful, was quite matter-of-fact. But at that point, we needed that honesty, because we needed to know what we were facing up to so we could start to get our heads around it. And it wasn't a great prognosis at that point, to be honest. At the time, I was quite shocked, and we reflected on it afterwards, and I thought, God, that wasn't very gentle, was it? That was really... But if she danced around it, we wouldn't have understood where we were. And she was quite frank. But then, of course, having established that reality, she then gave us some hope by saying what the treatment was. She was able to give us confidence from the hundreds of times they'd done it that it could work. So I think, frank, as long as there's a plan afterwards, is okay. Sugarcoating isn't always the best thing. So in summary, I would say it was very good. I was very lucky. So in terms of the information I got throughout my journey, I wish I'd used some of the charities that are around. So I know about them now, and indeed I'm volunteering for them doing this film. But early on it was Google, and that's really dangerous. The consultants said to me, beware Dr. Google, and you have to, but you're bound to, and your children will too, and that's even worse. So I wish I'd used things like Blood Cancer UK and Lymphoma Action, because a lot of their publications that I've now contributed to as a volunteer since are really good, and they've got real experiences in them. So I wish I'd read those more rather than random US research studies on the chances of survival of DLBCL that you don't really understand. They don't add a lot and they just worry you. So, what do I hope? I hope I stay in remission because I can cope with the side effects. I hope I can continue to rebuild my life post-work, because I retired in the middle of this journey and trying to get myself a bit busy again. And I hope that my family continue to see me looking and feeling better, because they obviously worry about me, even though we don't talk about it that much anymore. So I hope they can continue their journeys in getting over it, because let's not kid ourselves, it's been quite a traumatic few years for all four of us, to be honest. There is really good help out there from charities such as Lymphoma Action and Blood Cancer UK that take real life experiences from people who've been through this. And actually there's a really good online support forum on Facebook for Lymphoma UK, which I now contribute to sometimes, but boy, I wish I'd had that rather than relying on intermittent meetings with your consultant that are very precious and tend to be very medical about your next steps, or Googling. So look for the advice that's out there with these charities would be one thing. The second thing I'd say is there is hope. So, I mean, I've relapsed twice. I'm still here. The lymphoma is not the worst cancer in the world. I know it sounds odd. People say you've got cancer, but it is definitely treatable. That's the one thing that the phrase the consultants always use is, we're treating you with curative intent. Which I think is a lovely phrase, isn't it? As opposed to just prolonging your life for a bit. So remember, you're being treated with curative intent, and this thing can be cured. And if one thing doesn't work, there's always other paths. So on the relapse, yes, it was a horrible shock, because they tell you the first time it's with curative intent, don't they? And then they tell you you're cured, but then you relapse and you think, well, hang on, are these guys being straight with me? But these things happen, and there is always another path. So I've had 3 courses of treatment now, and I'm in remission now, which is great. If it comes back again, there is still another step. So don't worry, it's rubbish, but there's always another step, would be my second bit of advice. So what would I say to myself of 5 years ago? Yeah, make the most of your health while you've got it. Don't take anything for granted in life. And then when it does happen, I think I'd say to myself, wow, this is a shock, but it's going to be okay. And I would say, trust your medical professionals, but don't be afraid to say to them if you don't understand something. Again, you can be somewhat overawed by a consultant, particularly when you're in a difficult place. So I'd say to myself, don't be afraid to ask. Be a bit pushy if you think you need to. Stand up for yourself. It's your life we're dealing with here. But at the same time, trust them, because we have wonderful medical professionals in this country, and the Marsden in particular is a fantastic place. We're blessed. And don't worry, you'll be okay. And guess what? If things are difficult, then worrying about it ain't going to help. They're still going to come anyway. So try and be positive and think that it'll be all right. And chances are it will. What did I learn? I learned there's a lot more to life than work. Although I learned that I did miss my work. And I really miss that human interaction and that intellectual challenge. So I do need that, and now I'm getting better. I think I need that again, more than I thought I did. I've learned that I'm very lucky to have my family around me, my wife and our 2 daughters, and I'm more grateful for that now than I've ever been. And I've learned that maybe I am a bit stronger than I thought I was. I mean, the family were always joking with me. I was a bit of a wimp if I ever scratched myself or went through something, but they can't say that now, can they? I'm actually probably a bit more resilient than I thought I was. It's remarkable what you can do when you've got the right support around you. So Don't be afraid of what the future brings. Look forward to it.